Overview: Prolapse and hemorrhoids, an alternative approach to the surgical treatment of hemorrhoids. In order to explain the rationale of the procedure for prolapse and hemorrhoids, it is helpful to take a moment to review some concepts of anatomy. The three hemorrhoidal piles consist of a capillary network of arteriovenous shunts, which allows a swift hematic repletion and depletion, making it possible to rapidly modify the volume of and strain on the hemorrhoidal piles. The tone of the anal sphincters influences this physiological function through direct mechanical compression and by means of the modulation of the inflow and outflow of the intersphincteric hemorrhoidal vessels. This enables the hemorrhoidal piles to help maintain continence. In addition, the anal mucosa and anoderma enable the distinction of anal contents, and the mucosa covering the hemorrhoids forms three folds that stretch, giving the anal canal dilative capacity. Therefore, the preservation of the hemorrhoidal piles is a physiological advantage, while their removal implies a decrease in the anal canal continence. The vascular structure is supported by unstriated and connective fibers from the longitudinal tunic, intersecting the unstriated sphincter to the muscularis mucosae of the anal mucosa. Since these fibers are involved in a natural process of deterioration resulting in thinning and fragmentation, hemorrhoidal prolapse can occur with a displacement of the distal rectal mucosa. A prolapse causes distortions of the vascular structure with stretching and elongation of the upper hemorrhoidal vessels and formation of kinks in the middle and lower hemorrhoidal vessels and in the connection of internal and external piles. As a result, the venous outflow can be hampered, especially if associated with sphincterial hypertone. While the displacement of the rectal mucosa in the anal canal is temporary in the second or third degree hemorrhoidal prolapse, it is permanent in a fourth degree prolapse. This may cause continence disorders, such as moist anus, soiling, and leakage. If the prolapse is the morphological condition predisposing to hemorrhoidal complications and continence disorders, we can reasonably expect the correction of this alteration to be sufficient to treat the disease. The PPH technique, also called stapled hemorrhoidopexy, aims to correct this prolapse by means of the circumferential excision of a band of rectal mucosa above the hemorrhoids. This procedure involves lifting and fastening the anal mucosa and hemorrhoidal piles in their natural anatomical position.